Essentials of Pharmacology for Health Professions, 9th edition, Chapter 22. Anticonvulsants, anti-Parkinsonian drugs, and agents for Alzheimer's disease. Upon completion of this chapter, you should be able to describe the different types of seizures. First one is list the medication used for each type of epilepsy and the common side effects. Describe the drug therapy for febrile seizures. List the drugs used for the Parkinsonism and side effects. Describe the patient education appropriate for those receiving anticonvulsants and anti-Parkinsonian drugs. Describe the drug therapy for the treatment of restless leg syndrome. And describe the drugs for the treatment of Alzheimer's disease. Okay, we're going to talk about anticonvulsants, seizures, and epilepsy. Seizures are defined as a brief, abnormal neuronal discharges in the brain that occur repeatedly for a variable length of time. Seizures can occur randomly or be related to conditions or injuries. Anticonvulsants are used to decrease the number or severity of seizures. Epilepsy is defined as 2 or more unprovoked seizures separated by a period of 24 hours. Epilepsy is the 4th most common neurological disorder in the United States. Okay, we are going to talk about primary generalized seizures, which usually begins with a widespread electrical discharge, and it happens on both sides of the brain. You have convulsion, which can be tonic-clonic and tonic-clonic, or you can have non-convulsion, which can be either absent, myoclonic, and atonic. Your initial treatment is going to be, of course, to prevent injury. On your generalized seizures, they can include tonic, clonic, and absent seizures, and it occurs in about 40% of our patients that has epilepsy. Tonic pertains to tension or contraction, particularly muscle contraction. Tonic-clonic seizures are characterized by an abrupt loss of consciousness and falling, with tonic extension of trunk extremities, tonic phase, followed by alternating contraction and relaxation of the muscles, which is the clonic phase. Absent seizures are so called because of the absence of convulsions. They are characterized by a sudden onset and a brief 10 to 20 second loss of consciousness, which no falling and usually only occurs in children. Your partial seizures, which is a focal electrical discharge and is only limited to one side of your brain. Your simple partial seizure means that you had no loss of consciousness. A complex partial seizure is loss of consciousness. Partial seizures counts for about up to 60% of the new cases that are labeled epilepsies. They are caused by lesion in the temporal lobe of the brain and are limited to one cerebral hemisphere. Most seizures last from 10 seconds to 5 minutes. Complex symptoms can include confusion, impaired misunderstanding and judgment, staggering, purposeless movements, bizarre behavior, and unintelligible sounds but no convulsions. A partial seizure may be preceded by a subjective but recognizable sensation, which is an aura that a seizure is going to occur. Let's make sure that we read the clinical connection on page 452 in your ebook. And let me just leave this with you. Febrile seizures are the most common childhood seizure disorder and occurring in approximately 3% of children that are ages 6 months to 6 years. Knowledge check activity. Epilepsy is defined by how many unprovoked seizures separated by a 24-hour period. Get your choices and write down your answers. We'll check it at the end of the video. Okay, so we're going to look at the drug therapy for generalized and partial seizures. You have the first generation anticonvulsants. The aim of this therapy is to prevent seizures without over-sedation, and the dosage is adjusted according to the individual patient response and serum drug levels when available. Your medications are there for you to see. You have the side effects, and you also have the drug-drug interactions. Pause the video for a minute. Make sure to read those and understand. Now let's check your activity, which is not a side effect commonly found in the use of epilepsy medication. Look at your choices, write down your answers, and we'll check it at the end of the video. Drug therapy for febrile seizures. The routine treatment is find the cause of the fever, take measures to control the fever, and try multiple antipyretic drugs. American Academy of Pediatrics Subcommittee on Febrile Seizures does not recommend use of anti-epileptic drugs for children with one or more simple febrile seizures. Children with complex febrile seizures may be prescribed anti-epileptic drugs on an individual basis, but the first thing is to find out what the cause of it is. Knowledge check activity. Which drug category is recommended in the treatment of febrile seizures? Look at your choices, write down your answers, and we'll check them at the end of the video. Drug therapy for absent seizures. What you're looking at is medication, side effects, and drug-drug interactions for those. I'm going to let you pause the video for a minute and take a look at it and read it and make sure you understand it. What the medications are, what the side effects are for them, and what the interactions are. Alright, patient education for anticonvulsants. Patients taking anticonvulsant medication should be provided with the following patient education, which would be you reading the provided medication guide before they start taking an anticonvulsants and each time they get a refill. Taking caution with driving or operating machinery until they are regulated with the medications because of drowsiness or dizziness. Reporting side effects such as a rash or eye problems, staggering, slurred speech, or any other symptoms. Ensure careful oral hygiene until tenderness of the gums subsides as treatment progresses. Always taking the medication on time and never omitting dosages. Abrupt withdrawal of the medication can lead to status epilepticus. Always wearing a med alert tag or bracelet in case of an accident or an injury. Taking the medication with food or milk to lessen stomach upset. Checking with the healthcare provider before initiating any new treatments, and that includes over-the-counter or herbal products. Anticonvulsants are associated with numerous and potentially harmful drug interactions. No ingestion of grapefruit juice while on Tegretol because of potentiation of effect, so no grapefruit juice. Parents and teachers should be cautioned to observe and report changes in cognitive function, mood, and behavior in children receiving anticonvulsants. Some anticonvulsants cause an increased risk of birth defects if used during pregnancy. Women of childbearing age taking anticonvulsants should be educated on using proper contraception. Knowledge check activity. Which patient education would be provided to patients using anticonvulsant medication? Look at your choices, write down all that apply, and check your answers at the end of the video. Alright, so now we're going to talk about the anti-Parkinsonian drugs. For a second, let's talk about Parkinson's disease. The figure you are looking at is figure 22-2. It tells us what is Parkinson's disease, and it also gives us the symptoms of Parkinson's disease. We're going to look to the right. Anti-Parkinsonian drugs are usually given for Parkinson's disease, which is shortened for PD, and that is a chronic neurological disorder characterized by fine, slowly spreading muscle tremors, rigidity, and generalized slowness of movement, called the bradykinesia. The underlying pathology of PD is not completely understood right now, but normal dopamine activity as it relates to
Acetylcholine
is diminished, and relative overactivity of
cholinergic
outputs results. This serves as the foundation of treatments for PD. As we continue with anti-Parkinsonian drugs, we're looking at drug classification, side effects, and comments. Make sure you read this table. It's very helpful. It has a lot of good information, and make sure you read it. As we continue, knowledge, check your activity. The question is, which is not a common side effect for dopamine agonists? Read your choices, write down your answers, and we're going to check them at the end of the video. So patients that's taken any anti-Parkinsonian medication should be provided with the following patient education. That means that is what you're going to do. Administration on a regular schedule as prescribed with food to lessen GI distress. Give carbidopa, levodopa with low protein meal if food is necessary to offset any nausea. Avoiding abrupt withdrawal of the medication, which may greatly increase Parkinsonian symptoms and the risk of neuroleptic malignant syndrome. Several weeks sometimes are required before you can actually see the benefit. Caution with CNS drugs, alcohol, or antihypertensives. Not taking other medications, including vitamins, without the physician's approval. You need to get the physician's approval first. Caution with driving or operation of machinery. The facts that drugs may cause drowsiness, dizziness, lightheadedness, with pramexazole. There may be no warning signs before falling asleep while engaging in activities of daily living. Reporting adverse side effects to the physicians, and they can be any of the following: involuntary movements, blurred vision, constipation, urinary retention, GI symptoms, palpitations, and mental changes. With dopamine agonists, there may be intense urges to gamble or spend money, increased sexual urges, bouts of binge eating, and other intense urges. Reported any signs that the drug is no longer effective after prolonged use. Sometimes after months or years, the doses may need to be increased, or another drug may need to be substituted by the physician. Avoided any dosage changes without medical supervision. Maintaining physical activities, self-care, and social interactions, which is an essential part of therapy for Parkinson's disease, and rising slowly. So if you're sitting, make sure to rise slow. Restless leg syndrome. What is the etiology of it? Restless leg syndrome is a sensory-motor disorder characterized by a distress and urge to move the legs. RLS is often accompanied by aching, pulling, burning, itching, or tingling sensations. RLS often interferes with a person's ability to rest or sleep. It may be primary or secondary to other causes. The etiology of RLS is either primary or secondary. Primary RLS involves the CNS in the dopaminergic pathway. The medications for primary RLS is involving the CNS in the dopaminergic pathways. Dopamine agonists are used. These include Mirapex, Recrip, and Nupro patch. For your secondary RLS, such as neuropathy related to diabetes or extensive back surgeries, drugs including Neurontin, clonazepam, hydrocodone, oxycodone, or tramadol are used. Now let's check activity. Which drug is a second-line agent used in the treatment of restless leg syndrome? Look at your choices, write down your answers, and we'll check them at the end of the video. case study. Our case study is a patient informs the physician that they are having a difficult time sleeping as when they lay down in bed. Their legs begin to burn, switch, and experience tingling that keeps them from falling asleep. Upon examination, the physician diagnoses the patient with. Look at your choices, write down your answers, and we'll check them at the end of the video. Alright, some agents for Alzheimer's disease. You have a column for medications, your side effects, and your drug-drug interactions. Pause the video for a minute and take a look at it. The blue is just letting you know which is what. Knowledge check activity, which is a contraindication for AirSelf. Look at your choices, write down your answer, and we'll check it at the end of the video. Okay, let's see what you got. Let's see what you can answer. Self-assessment. What are the two different groups of seizures that are differentiated by how they begin in the brain? What are the different classifications of anti-Parkinsonian drugs? What are the common symptoms associated with restless leg syndrome? Take a few minutes and write your answers down. Okay, so we have come to the end of this chapter. These is the answers to your knowledge check activities throughout the video. Pause the video and check your answers and see how well you did. And if you have any questions, go back to that particular area and read over it again. And if you have any questions, make sure you reach out to me. Thank you for listening and have a great day.